Well, I've been at the Community Health Center for 19 years, going on 20 years. And in that amount of time, I've seen a lot of changes. Terry, our nurse, and I, when we first started this program, we had fishing tackle boxes that we purchased for people, because that's how many medications they had. And it's down to now, there she is, Terry. It's down to now you can put their pills in a little tiny box this size. So we've had to adapt over the time with all of the different changes, and Randy, our PA, knows that. He's treating patients there also. And so that with all of those changes, we continue to see more changes. And before I talk to you about some of the news that's going on right now in the HIV world, I wanted to read a very important poem that George passed to me. And it's by a woman called Alta Morgan. She attended all of our World AIDS Day events. She was a part of the AIDS Coalition that we have now established again. Many of us have resurrected the Siouxland AIDS Coalition from the 90s to today. And Alta always participated in all of those events, candlelight memorials and World AIDS Day events. And the dear soul also lost her son to HIV before we had protease inhibitors that might have saved his life. So she wrote this poem in honor of World AIDS Day. The time has come for all to remember World AIDS Day, the first day of December. Many loved ones have struggled and lost their lives to this disease at a very high cost. Quilt panels were made and put on display to honor our loved ones in a memorable way. Each panel spoke of a daughter or son, or a person they loved as a special someone. So on World AIDS Day in December, let us count our blessings as we remember those we cherished and miss each day, as we embrace their life in a special way. Now unto God let us raise heartfelt thanks and loving praise for all who are received in that holy embrace and given God's healing and amazing grace. Alta Morgan, who is also an ordained minister, correct?
Yes.
Lay minister. So thank you to Alta Morgan, who can be here sort of in spirit by the reading of that poem. So I just wanted to be able to tell you a little bit about what's happening on the HIV front today. There's been a lot of things going on. Last week, the CDC announced that young people are the up-and-coming number in this epidemic. So 26% of the cases every year are among youth between the ages of 13 and 24. So if you count up, there's about 55,000 new infections every year. That's about 1,000 infections every month that are in youth between 13 and 24. And we're well represented by youth tonight. We're going to have some great drama by youth and some other exciting things, and go on. Thinking about those youth, it's just really important that everyone get tested, everyone know their status, everyone be careful. Those of us who have worked in the field of HIV are living and breathing today the National HIV Strategy. It's become a part of all of our conversations. Every workshop, every meeting, every day, the work that we do is to align with the National HIV Strategy. So I know that many of you are not in the work of HIV and probably haven't even heard of the National HIV Strategy. So I just wanted to give you what the vision is, because it's a very long document, and if you want to know more about it, you can Google it. It's very interesting. It has really a plan for how we're going to end this epidemic. So President Obama in 2010 announced the National HIV/AIDS Strategy, which Jeff Crowley wrote. But here's the vision. The United States will become a place where new HIV infections are rare. And when they do occur, every person, regardless of age, gender, race, ethnicity, sexual orientation, gender identity, or socioeconomic circumstance, will have unfettered access to high-quality, life-extending care, free from stigma and discrimination. I think it's a really great vision, and this is what we have to live with every day, trying to figure out how the White and White Care Act fits into this, how public health fits into this, how our care fits into reaching the goals of the National HIV/AIDS strategy. Every day we're working with it. We also in Iowa have written a plan to match the National HIV/AIDS strategy. In fact, Courtney, sitting over there, and I helped write that plan for the state. And so how our state's going to align with that strategy and how we're going to end this epidemic. And then on that note, Hillary Clinton on World AIDS Day this year announced the blueprint for the map of how we're going to attain the National HIV/AIDS strategy. So this is really a big deal. This is really exciting that the federal government is involved and really wants to work with us in ending the epidemic. So part of that blueprint is sound investments to scale up prevention and to make sure that people get care and maximize the impact of that. We're working with partner countries and donor nations and civil societies and religious organizations, the private sector and foundations to utilize resources. And it does focus on women and girls to increase gender equality in HIV services. And it also is intended to end stigma and discrimination against people living with HIV and populations and improve their access and uptake to comprehensive HIV care. And it will also set benchmarks for outcomes and programmatic efficiencies through planning and reporting processes. So it's pretty exciting to have the plan, and we'll all be trying to achieve that plan. So like Mayor Scott said, and we've talked about, the name of this World AIDS Day and the future ones is zero new infections, zero AIDS-related death, and zero discrimination. That's what we're all reaching to achieve. Treatment of prevention was announced in 2011. A study showed that if people were treated early in the disease process and used a condom, there was a 96% less chance of passing this disease along. So it's really important to get tested, get everybody tested, get them on treatment, and that's one of the ways that there could be an AIDS-free generation. So the AIDS-free generation vision is scientific advances and their successful implementation have brought the world to a tipping point in the fight against AIDS. The United States believes that by making smart investments based on sound science and shared global responsibility, we can save millions of lives and achieve an AIDS-free generation. I would like to caution you, though, that even though we have these tools and we have this knowledge, negative people need to stay negative. It really, there's a lot of work to be done on everybody's part. And remember that it took one person at a time to begin this disease, and it will take one person at a time to end it.